Hi, this is Ramya from 𝗂𝗵𝗶𝗹𝗲 Master near 𝘄𝗵𝗆𝗀𝗃 Medical College, 𝘂𝗵𝗃. Okay, so today I'm here with a requested video. So actually I heard people having confusion like how to select case notes when they are writing letters to different healthcare professionals. As an OET aspirant, you people will be writing letters to different healthcare professionals. It can be either healthcare professionals or non-health professionals. It depends upon the writing task. Okay, so how to select case notes according to the profession? So in this video, I will be discussing about two professions, that is dietitian and a physiotherapist. How to select case note according when it is a dietitian and when it is a physiotherapist. Okay, so first we can go with dietitian. Okay. So what all things has to be kept in mind when you are selecting case notes when you are writing to a dietitian? The first one is that you should understand patient's weight, height or BMI. That is an important thing which should be included in an OET letter. Okay, when you're writing to a dietitian. So if the patient's height and weight or BMI is given, you can go for writing that one. So you don't want to write both height, weight along with BMI. Okay, either one can be written. Either you can go for writing height and weight, or else you can go for writing BMI. Okay, that's clear. Second one is that if this particular patient has a weight gain or a weight loss in the recent past. Okay, so over the past few months, does the patient have some weight gain or weight loss? That should be included when you are writing a letter to the dietitian. Okay, third one is like if this particular patient have some food preferences. You know that certain people will be having food preference. People will be liking or people will prefer to have foods like fast food, sugary food or junk foods. Okay, so if such preferences are there, definitely you have to include that too when you are writing to a dietitian. Okay, next one is that if this particular patient have some food allergies. Okay, so there are people who have some allergies and it can be food. Okay, so food like peanut or egg, meat, something like that. So sometimes people will be having allergies with these kind of things. So if there is any type of food allergies, that should be there when you're writing it. Okay, next one. What is the next one? The thing is like you should include those things which are related to diet related disorders. Okay, so what is this diet related disorders? Like sometimes a patient will be having a condition like diabetic hypertension. Obviously, these two things will be included. You people know that one, I know. But there are certain other things also which has to be taken into noted when you are writing to a dietitian. What are they? Sometimes this particular patient will be having some pancreas related conditions. Okay, so if such things are there, definitely that also has to be included. Like sometimes the patient will be having cystic fibrosis or something like that. Okay, so if such things are also there, it's better to include. Apart from this diabetes and hypertension, these kind of condition, if it is present in the case note, you have to include that too. Okay, next one is about the digestion and absorption related disorders. Some people will be having things like that, like a gastroenteritis. Okay, if a patient is having some problem with this digestion and absorption, definitely this patient should have some food, should be given advices related to food, which thinking about these kind of things also. Okay, so if this particular patient is having some digestion or absorption related disorders like gastroenteritis or something like that, that also is quite important when you are writing a letter to the dietitian. Okay, next one is about if this particular patient is wearing any dentures or artificial teeth, definitely that also should be included. Okay, because sometimes this particular patient may not be able to take a heavy food. He should have only oral fluids or a light food. So this type of information should also be included when you are writing a letter to a dietitian. Okay, next one is that sometimes this particular patient may have some difficulty in swallowing or chewing food. This can be because of many reasons. Sometimes this particular patient may have some mouth ulcers, or sometimes patient may be recovering from a stroke or something like that. So definitely the food should be prepared accordingly. So that also should be mentioned when you are writing to a dietitian. And last thing is like if this patient is taking any regular medications. Okay, so you know that if the patient is taking diabetic diet, definitely the dietitian should know that, so that only he will be able to prepare low-fat diabetic diet. And if this particular patient is having some hypertension, should know that, because low salt is needed. Okay, so it depends. So if the patient is taking some medication, that is regular medication, that should also be included when you are writing a letter to the dietitian. Okay, so I hope what are the things you understand, what are the things to be included when you are writing a letter to the dietitian. Okay, so now we can see what should be included, what are the relevant case notes that you need to select when you are writing to a physiotherapist. Okay, obviously you have to include mobility related problems. Okay, because definitely when we are writing a letter to the physiotherapist, that means you need some assistance with the mobility. So if this particular patient has some problem with mobility, you have to include that one. Okay, next one is that if this patient has some neuro or ortho related problem, that too should be there. Sometimes you can say that these patients may not be having it cannot be neuro related as such. Sometimes it can be some ortho related. Sometimes this patient may have some hereditary condition, or else by birth itself this particular patient has some problem. So you have to include, like for example, the patient is walking with a limp, that is due to some cerebrovascular accident, or due to some stroke, something like that. Okay, so if such situations also come across your case note when you are writing to a physiotherapist, kindly include that too. Okay, the next thing is that if the patient is using some assistive devices for walking, like a wheelie chair or a walking stick or something like that. Okay, if the patient is using some assistive devices for walking, definitely you have to include that too. Okay, the next thing is that if this particular patient is taking some regular medicines, okay, you have to include. You may be thinking like, why we have to include about the regular medicines? Definitely that is quite important. You know why? Because sometimes when this physiotherapist is doing some exercise forms with this patient, if suddenly the patient becomes sick, definitely the physiotherapist need to know why this happens, isn't it? For that, he should know that whether he is taking some diabetic medicines or hypertension medicines or some medicines. Okay, so that he will be able to understand when the patient becomes sick, it's solely because of these conditions. Okay, so that is another thing. And the last one is that you have to highlight the post-operative recovery. Okay, post-operative recovery means sometimes the patient may have a hip replacement surgery. So if something like that has happened, definitely you have to include that field, like a post-operative recovery phase, what all things has been done and what is the present condition of the patient, whether he can walk without assistance or does he need some assistance. All these things should be included. Okay, so I hope the video is clear. You got a clarity of a selection of case notes when you are writing a letter to a dietitian and a physiotherapist. Okay, so if you think that this video is useful, kindly share it with your friends. Thank you.